Intensive care beds are filling up. Other provinces and the military are sending help. But Ontario's premier says the problem lies at the borders.
Their federal jurisdiction. And I assure you, if I had the power, I would close down Pearson Airport immediately. I would shut down the land border crossings to only those who are absolutely essential.
Ford wants the federal government to impose mandatory pre-departure testing for all domestic flights into the province. And he wants a mandatory 3-day hotel quarantine for people who cross into Ontario from the U.S. by land.
The borders are broken. We need to fix it.
But data collected by Ford's own government suggests the border isn't the biggest problem. Of the 109,000 new COVID cases detected this past month, just 1,200, about 1%, were travel-related. The rest overwhelmingly from community transmission or close contact with someone who is infected.
Importation through the borders is extremely low in terms of cases in the country.
Which is why the Prime Minister was cool to Ford's proposals, unwilling to add to the federally mandated layers of tests and quarantines that already exist, instead trying to put the focus on the main driver of new cases.
We have seen that this third wave is very much around community transmission.
It's a message Ontario doctors and scientific advisors have delivered to Ford repeatedly, and repeatedly complained their warnings have gone unheeded as Ontario reopened. Trudeau says it's within Ford's power to severely limit domestic travel in Ontario. He points to the example of the Atlantic provinces and their mostly successful bubble, something done without the intervention or the permission of the federal government. David Cochran, CBC News, Ottawa.